So I've been a doctor for 30 years now and I love my job. I've had patients who've followed me for almost 25 years. And it's partly because I love my job that I've become an advocate for climate change and action regarding climate change. I'm at the coalface of what climate change is doing to the population. I see it impact my patients. It's so important for doctors to speak out, because if doctors don't speak up about climate change and health, who else will? I work in northwestern Sydney and we've just had the highest temperatures for our January and March. And in Western Sydney, during heat waves, the temperatures can be up to 6 to 10 degrees hotter than the rest of Sydney. We've got extreme weather, and the extreme weather is impacting on the health of the people within those communities. There really is a 14% increase of the number of people who present to A&E during the hot weather, and a 13% increase in mortality. It's the vulnerable people in our community, those who are isolated, those who are impoverished, the very young and the very old, and the health sector that are bearing the cost of climate change in our community, not the fossil fuel polluters. And not only do we have the impacts of heat, we have the impacts of ozone. Ground level ozone is tightly connected with how hot it is, and we've got good data for this. Ground level ozone is a mixture of oxides of nitrogen and from volatile organic compounds. When these two chemicals combine in the heat, it's a chemical reaction and it causes ozone. And there's no safe level of ozone to breathe in. People who have to work outdoors have no choice. They breathe in the ground level ozone and they're outside during the heat. Children are especially vulnerable because they've got a larger surface area of lung. And so it's like a sunburn to their airways. Children who are chronically exposed to ozone, you can impair the growth of their lungs. With my patients with asthma, it exacerbates their asthma. This summer I had so many patients who actually ended up in hospital because their asthma was exacerbated by ground level ozone. And with patients with heart or lung disease, it exacerbates their heart and lung disease. So with the combination of ozone and the excessive heat, this increases the risk of heart attacks. One of my patients died in January this year during a 42-degree heat wave. He is typical of my very elderly patients. He's 78 and he had heart disease, he had lung disease where he needed to actually use an oxygen extractor for 16 hours a day. On the day he died, it was 42 degrees and it was a toxic ozone day. He went out on his scooter to go to buy some bread. And he breathed in the ozone and he was dehydrated. When he got home, he died. It was a Saturday afternoon. I was called by the police to do the death certificate. So I've been looking after this patient for 14 years. It's heartbreaking. So, God. Yeah. We have to look at the communities surrounding coal-fired power stations as well. We've had a study recently by the Environmental Justice Australia that showed that there is increased risk of type 2 diabetes and small for gestational babies, which means that babies whose mothers breathe in this air pollution are smaller. And we know that years of exposure to pollutants causes heart disease and lung disease and increases the risk of cancer. It's just horrifying that we have 3,000 people a year who die from air pollution. We have less people who die from road traffic accidents, and we don't focus on the deaths from air pollution or from heat. It's appalling. When you think about climate change as an individual, it's absolutely overwhelming. We need to mobilise and advocate for better policies for mitigation of climate change. We've had the children's strike, we've had 2 children's strikes in Australia. We had 30,000 people in the Sydney children's strike. The children in our community realise that their health and their future and their environment is being impacted by climate change, and we have politicians who don't listen to that. So it's a matter of getting these government to realise that, climate change is a health problem, and that if they don't do something about it, it's their communities that will be impacted.